Hello, it's Ashley here from Paper&Twine, and I thought I would come and speak to you today because it is 12 weeks, 3 months since I had surgery for cancer. I'm going to insert a little bit of footage now of what my wound looks like after those 3 months. So if you're triggered by signs of surgery and an old lady's flabby belly, I advise you look away now. So 12 weeks on, the scars have healed very well. They don't hurt at all. Occasionally inside I do get a little niggle here if I overstretch or overreach, or if I've done anything a little bit too strenuous. But, you know, honestly, 3 months on, there's absolutely no after effects at all. Perhaps we'll compare that with what it looked like a week or a day after surgery. So you can see the colours in the bruise are coming out more. I wondered what this red mark was here, but then I remembered they'd injected me with an anti-clotting substance. And yeah, you can't really see, there's the other port there. Oh, it still hurts, but I'm going to potter downstairs and have a little sit in the garden. So if you're new here, my most recent cancer was a kidney cancer. In 2020, I had been diagnosed with endometrial cancer, cancer of the womb, and in 2013 I was diagnosed with cancer of the breast. And it is very difficult to hear those words, you have cancer, and perhaps I'll talk about that in another video. But I want to just talk about what's next for me. Having had 3 separate unrelated cancer diagnoses is quite unusual. Sometimes people do get multiple cancers, but generally speaking, they can be linked to a primary cancer, i.e. they've spread or metastasised. That's not been the case with me. So I have been referred to a genetics counsellor, and I've had that meeting. And what they've done is they've requested bloods, which I've given, and they're doing some testing on tissue sampling. The conversation that I had with the person, who was very nice, suggested that I may, and it is a small chance, I may have a syndrome called Lynch syndrome, which makes you susceptible to developing certain types of cancer. And in this case, endometrial cancer and kidney cancer are linked in women. In men, prostate cancer and kidney cancer are linked. My father has had prostate cancer and currently, coincidentally, like myself, has a tumour in his left kidney. So I had surgery 12 weeks ago and I'm feeling absolutely fine now. I'm just waiting on those test results to come back from the genetics clinic. My renal nurse phoned me with the results of my recent surgery about 10 days ago and confirmed that it had been a cancerous tumour that they removed from my kidney. And the good news was that it was low grade. It was a mixture of grade 1 and grade 2 cells within that tumour, which is very low. And I had something called clear cell carcinoma, which is a very common type of kidney cancer, and the risk of it returning is very low. How am I feeling emotionally? I think I've been a little bit depressed. People who have had treatment for cancer do develop depression, and it's quite hard thinking that if I do have this syndrome, one of the places where the cancer could attack next is my brain, and that really just freaks me out. Breast is fine. I don't need my breasts. I'm not breastfeeding children anymore. You can cope with just one kidney, and thankfully I have 1 and a bit kidneys. I have gone through the menopause. I do not need my womb anymore. But how would I cope without my brain? Well, I wouldn't be here, would I? And I must at this point say thank you so much to all of those wonderful people in our wonderful NHS. And I will not hear a word against those doctors and nurses who day in, day out work in poor conditions in our broken hospital system. And yeah, I'm so grateful to them for everything that they've done to me. And I'm grateful to you guys for watching. I think I will come on and do a video, perhaps in a few months' time, discussing what it's like to have a cancer diagnosis. I think for some people, it can be devastating, but very sadly, it's a word that we hear more and more and more, isn't it? I do remember when I was a very small child, hearing the word cancer terrified people because it was a death sentence. Thankfully, it's not like that these days. When I was a small child, again, we were told the statistic 1 in 3 people would develop cancer. Now it's 1 in 2. And I bet every single one of you watching has been touched by cancer in some way. If it's not you, then it may be a friend or a family member. And I'm so thankful to be here. And I'm thankful to you guys for watching. So please do give a thumbs up, like, share and subscribe. If you've been affected by cancer in any way, there are loads of people that can help you. There's Macmillan, there's Cancer UK, all sorts of organisations out there. But I'm going to stop there now. Thanks so much for watching. Take care. Bye now.